My name is Clarence and this is my cranial nerve evaluation video. Hi, I'm Clarence Good. Is it okay that I perform this evaluation on you this afternoon?
Yes.
All right, fantastic. So do me a favor, can you inhale through your nose for me? Great. Okay, can you close one nostril and inhale once more? Switch nostrils and inhale. Was the intensity of inhalation the same on both sides?
Yes.
Fantastic. Will you close your eyes for me? Can you close one of your nostrils again? I'm going to present you a smell. Smell for me. Switch nostrils. Smell once more. Can you tell me what the scent was?
Coffee.
Fantastic. You can open up your eyes. And was the intensity of smell the same on both sides?
Yes, it was.
Fantastic. Okay, now I'm going to go and check your eyes. Here I'm going to be checking his retinas and checking his red reflex. Here I'm looking to see if there's any AV nicking, any papilla edema, or any cotton wool spots present. And look over the shoulder for me. Okay. Just look over that shoulder for me. Okay. Now I'm going to perform a peripheral vision test on you. Will you do me a favor, close one of your eyes with your hand, and once you see my fingers coming into your vision, just tell me when, okay?
Okay. 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 Okay.
Just look straight ahead.
Okay. Okay.
Okay, switch eyes.
Okay. 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 Okay.
Okay. All right, so relax for me. Now just look straight ahead. I'm going to be looking at your pupil dilation. Okay. So direct, consensual. Direct, consensual. Okay. Right here, I was checking to see if his pupils both dilated when I shined the light in his eye. If both pupils did not dilate, that would tell me he has an issue with his cranial nerve II. But if only one dilated and the other didn't while I was shining the light into his eye, that would tell me he has a cranial nerve III lesion. Okay, now I'm going to be checking swinging light test. Checking to see if both pupils dilate to the same intensity. If one pupil did not dilate to the same intensity, that tells me that he has a Marcus Gunn pupil. Okay. So now just look straight ahead for me. I'm going to check to see if there's any ptosis present, a drooping of the eyelid. Okay, to close your eyes. I'm going to see if there's any blepharospasm present. Okay, so look. So open up your eyes. Thank you. Now just focusing on my finger. Just follow where it goes, and I'm checking for his convergence. Okay, so just stay on my finger, then look at the wall, finger, wall, finger, wall. And right there I was checking for the accommodation of his eye lenses. Okay. Now, just focus on my finger and just follow wherever it goes, okay? Ocular muscles. Okay, now I'm going to go in and check sensory in your face. Okay, I'm just going to be rubbing this across your forehead, across your cheek, and across your jawline. It's going to feel like this. All right, so do me a favor and close your eyes for me. Okay. Intensity same all the way through?
Yes.
Intensity same all the way through?
Yes.
Intensity same on both sides?
Yes.
Intensity same all the way through?
Yes.
Intensity same all the way through?
Yes.
Was intensity same on both sides?
Yes, it was.
Intensity same all the way through?
Yes.
Intensity same all the way through?
Yep.
Was intensity same on both sides?
Yes.
Fantastic. Open up your eyes again for me. I'm going to be doing the same thing, but with this cotton swab right here. That's what it feels like.
Okay.
Okay? So again, close your eyes. Tense the same all the way through?
Yes.
Tense the same all the way through?
Yes.
Tense the same on both sides?
Yes.
Tense the same all the way through?
Yes.
Tense the same all the way through?
Yep.
Tense the same on both sides?
Yep.
Tense the same all the way through?
Yes.
And tense the same all the way through?
Yes.
So tense the same on both sides?
Yes, it is.
Fantastic. Open up your eyes for me. Now I'm going to be checking your muscles of mastication. I want you to clench down like you're biting into something. Fantastic. Open up your jaw against my hand. Great. Okay. Now just relax your jaw. I'm going to check your jaw reflex. Perfect. Okay. Now I want you to lift up your eyebrows in surprise. Great. Now clench. Now squint your eyes. Thank you very much. Okay. Now puff up your cheeks for me. Great. All right. Now give me a good old smile. And think of the funniest thing you've heard today. All right. Fantastic. Okay. Now moving on to your hearing. So first I'm going to do a rubbing finger test. I want you to close your eyes, and whenever you stop hearing my fingers, let me know.
Okay. Okay.
Okay, fantastic. Open up your eyes. Okay, I'm going to put this tuning fork on your head and tell me if the sound lateralizes to one side over the other, okay?
It's a little loud right here.
Okay, so that was Weber's test. I'm not going to go into Renee's test. Tell me once you stop hearing it.
I'm hearing
Okay, can you still hear it?
you. Yes, I can.
Okay, so since he heard it longer after I took it off of his mastoid, that tells me the air conduction was longer than the bone conduction. That tells me that he has a neurosensory loss on his opposite ear. However, if the air conduction was shorter than his bone conduction, that would tell me that he has a conduction loss on the same ear that I just tested. Okay, so now just look straight ahead. I'm going to be checking for any resting nystagmus in his eyes. Side. All right, can you stand up for me? Just stand on this side for me, and I want you to walk heel to toe towards me, please. Fantastic. Okay, go back to starting position, and I want you to do the same thing, but close your eyes, and I'll push it right here just in case you fall. Fantastic. All right, sit back down. Okay. Whew. Now I'm going to move on to Cranial Nerve 12. Can you open up your mouth for me? Okay, I'm going to be checking his tongue, see if there's any atrophy or any fasciculations of any kind. Can you stick out your tongue for me? I'm going to check to see if it deviates to one side or the other, telling me if there's a possible lesion in Cranial Nerve 12. Okay, and will you stick your tongue up against your cheeks for me? Checking those tongue muscles. Great. Okay, so again, open up your mouth for me. Give me a good old ah. Great. Okay, I'm seeing the palates elevate. I'm also seeing if there's deviation of his uvula to one side. If it does deviate, that tells me that there's a possible ablative lesion. Can you open up your mouth once again and give me a good old There, I'm checking to see if the palates elevate symmetrically, and if they don't, that tells me there's a possible physiological lesion in Cranial Nerve 12. In Cranial Nerve 10. Okay. So now I'm going to check your gag reflex. Open up wide for me. Just lower your tongue for me. Here we go. Okay. One more. All right, great. All right. Okay, now moving on to Cranial Nerve 11. Going to stretch your trapezius muscles. Resist against my hands. Great. Now your SCM. Resist against my hand on this side. Great. And the other side. Fantastic. That was my cranial nerve evaluation.